The St. Louis Ovarian Cancer Association has a month of events planned during September to bring awareness to the disease. Joining me are the Executive Director, Susan Robben, and Katherine Fuh, Assistant Professor of Gynecologic Oncology, that's a mouthful, at Washington University of Medicine. Thank you for joining me, ladies.
Thank you.
So first and foremost, what is SLOCA?
SLOCA is an organization dedicated to raising the awareness of the disease, the signs and symptoms of the disease, educating the public, funding research, and supporting survivors.
And I jumped right into SLOCA, but what does SLOCA stand for?
SLOCA stands for the St. Louis Ovarian Cancer Awareness. SLOCA. It's the easy way to remember who we are.
So tell me about the organization. How did you come to exist?
Well, the organization was started by a very brave group of women who were undergoing treatment, survivors and oncology nurses. And together they realized that there wasn't any awareness effort in St. Louis for women to know ahead of time what the signs and symptoms are of the disease so that they would know sooner than later to seek medical attention and perhaps lead to a diagnosis.
Okay, Dr. Fuh, we hear the word cancer thrown around a lot. So tell us, what is ovarian cancer, but what is cancer?
So cancer is pretty much cells that are just gone awry. So they just keep growing and they proliferate, and they start to then metastasize or sort of spread to other organs and just cause basically daily functions that we are just take for granted and sort of start to put a big problem to those who have it.
All right, so then why do you feel like there needs to be an organization like SLOCA to bring support and awareness to ovarian cancer particularly?
It's been wonderful. So when I see my patients, those who are actually going through treatment or those who are survivors, I actually really refer them to SLOCA because they really need a group environment to be able to, bounce sort of their feelings, what they're going through, and also share the excitement if they actually are surviving the disease.
And Susan, why is this marriage, with the School of Medicine and between SLOCA, why is that something that's essential to our community?
Well, I feel like in an effort to support survivors, they have to come to us some way and self-identify. And through the infusion centers and gynecologic offices in St. Louis, we bring those offices and our materials and resources so that the healthcare professionals can give our materials and resources to their patients, and those patients then know that we exist and can call us and get together with us, support our events and our functions. But down the road, several of them end up being our true blue warriors and our volunteers who are out in the community handing out our information at health fairs and anywhere that we can go to set up a booth to raise awareness.
Sure. Dr. Fuh, what are some of the warning signs and that people should be paying attention to when they experience them, so they may not end up needing a group like SLOCA?
Sure. So they are very common symptoms that we have actually sometimes: bloating, abdominal pain, trouble with urinating, and sometimes when you're eating, you feel pretty full pretty quickly. So I can't say the number of times during the holidays that I have patients come in January, February, saying that, they just thought it was a holiday meal that kind of caused these symptoms. But there truly are symptoms. You have to just really listen to your body. If you feel like there's something off, definitely seek advice from your provider.
So what should somebody do if they're, is that something that they sit at home and go, I think I might have ovarian cancer? Like, that doesn't seem like something that anybody would say, let me go get that checked out.
Right. Well, usually if you are seeing your provider every year, usually during that time period, you'll really discuss those symptoms and perhaps have that exam. And if you don't regularly see a doctor, then if you do have those symptoms, then certainly see someone for that. And it's really just this chronic, you have it not just for one day after one meal, you're having it for a week, 2 weeks. Then you start to kind of really, question that.
Sure. So when they come see their doctor, then what?
So if they see their gynecologist, for example, certainly we all are pretty aware of that as an issue. So we take a good history, good family history, a good physical examination, and then depending on that, we may or may not perform certain tests to really try to understand what's going on.
All right. And Susan, one of the things you said is that you fund some of the research that the hospital does. Tell me why that's That's important. That relationship there is important.
Well, as a survivor, I was diagnosed at 23 and didn't really know anything about that disease. It completely caught me off guard, and I feel very fortunate that I'm able to do what I do and spread the word, but more importantly, lead to the funding needed to support research would lead to better treatments, earlier diagnosis, and ultimately a cure. So that is our ultimate goal, and it does take a lot of funding. So we're very happy that some of our events and our fundraisers, in addition to helping us raise awareness and support survivors, also fund the research that the brilliant doctors and researchers are doing.
Well, you just mentioned fundraising and some of your events, and you've got a whole bunch of them coming up because September is
National Ovarian Cancer Awareness Month.
Well,
right.
I want to talk about some of those events that you have
Great.
coming up. We have to take a quick break, but when we come back, let's talk about some of that, all right?
Sure thing.
We'll have more with STL. We'll have more with the St. Louis Ovarian Cancer Association after this. Stay with us.